In this video, I'm going to talk about spinal stenosis and how you can treat it without surgery. Now, there are different causes of spinal stenosis, and those can range from some serious, nasty diseases to some fractures and breaks of the bone to simple disc injuries and excess inflammation that is occupying a space and leading to the stenosis in the spine. But let me first start by explaining what exactly is stenosis and what does it mean. Now, we'll take the example of the lower back because you guys watching this video can see it more easily, but it can happen anywhere along the spine. It is most common in the neck and in the lower back. Now, you'll see on the spine here, there are these little holes that the nerves come out of. Those are bony canals. And if those bony canals become smaller for whatever reason, refers to stenosis. The hole has gotten smaller, and that can put pressure on nerves, etc., and lead to problems, pain, sciatica, those sorts of issues. You also have the central canal inside here where the spinal cord runs through. And if we have any sort of degenerative changes there or disc bulges again, that can occupy that hole and cause stenosis. Of course, as I said at the outset of this video, you can get more nasty and sinister issues that can occupy those spaces, but fundamentally the stenosis is not that helpful of a diagnosis. You need to know what is causing the stenosis so you can properly get to the bottom of the problem and figure out whether it's something that can be helped with. In the case of a disc bulge, you can decrease a disc bulge and therefore reduce the effect of stenosis and reduce the actual stenosis. Or if it's something like a pathological fracture or something a little bit more sinister, in that case, you may not be able to actually eliminate the cause of stenosis, and your approach might need to be slightly different, obviously depending on what injury is there and what exactly is going on from a pathology point of view, i.e. disease. Stenosis itself, though, when we're talking about disc injuries and those sorts of problems, is relatively simple to deal with. If you've got a disc bulge that's relatively acute and there's not a collapse in the disc, then by stretching out, taking pressure off the spine and helping this region down here heal effectively, you can reduce the invasion of that disc material into that hole and therefore reduce the stenosis. On the other hand, if you've got a more sinister, more long-lasting, more degenerative type disc, you have a little bit more of a different approach from a treatment standpoint. And that's because the disc here now, instead of having its fundamentally normal height but just being bulging slightly, it's decreased by say 50%, 75%, and we see that unfortunately in some cases. And in that case, the hole that this nerve is coming out of, this foramen, often called the lateral recess, is going to be impinged because the spacer, your disc, that was keeping it nice and tall, is permanently changed in height and now it's smaller. So a lower grade inflammation and minor nicking of the ligaments here through something silly like putting your socks on will cause a small amount of inflammation that, say for me or someone else, might not cause any problems, but if you've got some degenerative stenosis here as a result of that collapsed disc, then you're going to suffer an awful lot more. The advice there in the prognosis and how you're going to get on and what exercises you should be doing and even how we would tailor treatment to you would be slightly different in those instances, but there would also be some similarities as well. So I hope this video has been helpful on stenosis. The important thing you need to ask if you ever get diagnosed with this is, what is causing my stenosis? And then ask the question, is it something that I can change or is it something that I have to manage? Hope that helps. Thank you for watching. For videos on our Back in Shape program and how to get involved in that and work out from home to strengthen your back, click the link right here. For more recent uploads, then right up here. And if you want to subscribe so you don't miss any of our future videos and stay up to date with the latest back care advice, then subscribe to us above. Thanks again.